Computer. Hello, everyone. Welcome back. Thank you so much for joining me, Aditi Jasra. I'm a registered clinical counselor, and joining me today, we have Dr. Adam Will. He's a chiropractor. He did his education in States, and he was working in Victoria for a while, and now he is back in Tri-Cities. So I had opportunity to have conversation with him, got to know his work a little bit more, and I thought it would be wonderful for us to have this conversation so we can answer some of the questions that community usually asks us about chronic stress, anxiety, how it manifests in the body, and how chiropractic care can help. So Dr. Adam, I'll let you introduce yourself.
Yeah, hi. I'm so happy to be here. Yeah, my name's Adam. I am practicing currently in Port Moody and been doing this for about 5 years now. And yeah, I just really enjoy helping people, especially in through chiropractic because there's some different ways of doing that I don't think other professions can help with. So I'm happy to share some things today.
Yes, amazing. So how has it been back in Tri-Cities and working out of Port Moody?
It's great. There is fantastic. I mean, I grew up in Langley, but there's just so much to do outdoors. I got a young dog, so getting out hiking and exercising, running, gym, all those type of activities. It's kind of bred there, so I have a great time doing that.
Perfect. All right. So when you're not doing your work, we know you're walking your dog. But how did you get into chiropractic care? Like what got you into this modality of healing?
Yeah, so I actually never did chiropractic when I was younger. I my first time I got adjusted, I think I was 19. So I grew up as probably most people did, where if you had pain, you kind of just take Advil, Tylenol, deal with it, and just kind of suck it up and go on. So, but after a while, I had a big growth spurt in through my teenage years. A lot of physical sports, hockey and lacrosse were my main ones, and just ended up getting a ton of back pain, neck pain, led to headaches,
Mm.
and it was starting to affect my performance actually. So what ended up happening is, yeah, I kind of tried the physios and massages, and unfortunately for me, those just didn't seem to work. And then ended up finding a chiropractor from a recommendation from a family member, and did that, and that was kind of the first time the back pain went away, headaches decreased, and at that point, yeah, I was able to kind of get back in the gym more consistently, do more training, which then, yeah, I was able to continue on with my career. With lacrosse was kind of the main one I ended up sticking with. So, yeah, it made a big difference for me overall, and I was very happy to find it. And then as time went on, yeah, as I was looking for careers and things to do, and I was kind of joined the human body and trying to help people, it ended up with me choosing this career, which I'm
Right.
very happy about.
No, definitely makes sense when our own lived life experience guide our path. So do you see a lot of sport players in your practice? Do you work with lacrosse players or other sports?
Yeah, kind of generally, I tend to attract people who play a lot of sports, whether it's your weekend warriors or it's youth just playing sports, or even people trying to pursue more amateur professional. I guess a lot of it just comes down to the language. I've lived it. I know kind of what it's like, and I'm able to at least give some really good feedback on what to do, and kind of how to do it and how to manage that when it comes to pain, discomforts, training. So I've seemed to attract those individuals.
Right. So in your experience, like when there is that performance anxiety we have to make on the team, like does that manifest as chronic stress and does that show up in the body, in the spine, in the nervous system?
Definitely, yeah, yeah. When it comes to so stress overall is kind of your overarching header, and that can manifest in different ways. Usually, physical, mental, emotional are the three kind of big ones. So, um, if you do have more of that kind of mental stress when it comes to performance, it can then show up in physical ways, and that can be typically around like muscle soreness that is lasting longer. Heightened sense of sensitivity as well. So when it comes to the stress usually means then you have your nervous system. So your nervous system is kind of divided into two parts. When it comes to the automatic part, that's your sympathetic and parasympathetic. The way we kind of describe that is sympathetic is usually more um, your body is put into that when in times of stress. It's your kind of gas pedal, as we like to call it.
Right.
Ideally, then when we are finished with that set, we then move into our parasympathetic, which is what we call rest digest. Usually, recovery repair is happening with that. So if you are consistently stuck in that sympathetic space, the problem that arises over long periods of time is that then you don't recover and rest well
Right.
enough, and that can then usually leads to higher chance of injury,
Hmm.
um, and that's what we tend to see a lot of the time.
Right. Okay. So, how do you typically differentiate between pain that is caused by acute structural injury versus pain that is due to emotional or psychological factors, or when people are still stuck in their sympathetic mode?
A lot of that usually is through conversation or history. There are physical tests I can do on people to determine structural integrity of muscles, joints. They kind of see, at least in terms of, is this structure potentially have an issue with it that could be leading to pain or a
Mm,
lack of function in an area.
right.
Um, a lot of the times, it usually takes a few visits for people to kind of open up in terms of what else is going on with them.
Right.
Not everyone shares what exactly is going on with them through their intake form or even through my beginning questions when we're talking to them. A lot of
Mm,
that, I think, I find you got to build trust, and
absolutely.
sometimes just sharing stories of myself or other individuals that I've seen as well. That more to the story comes out because most people don't actually whether or not they want to share with me, but also they may not actually realize that it's actually affecting their injury, their recovery as well. So I find talking and if I'm able to get a few visits out of them where they start to feel more comfortable, that they typically will start sharing more of those things, which then I can address a little bit more easily.
Right. So, do you find that sometimes the shift has to be made from cure-oriented physical recovery? The mindset has to shift towards pain management or long-term functional recovery. Like, does that usually happen, and how do you make that shift?
Yeah, it's tricky because most people they know they're in pain and they want to be out of pain, and that's
Mhm.
completely reasonable because I think most of us have been in pain and it's absolutely terrible. And um, a lot of the times it's kind of the way I guess I frame things. You're always looking at more functionality, and then
Right.
how does the pain affect functionality of it? So that could be if you're in the gym, like how is doing a certain exercise, like how is that being affected? Could it be as simple as going for a walk with your grandkids? It could be walking your dog. It's really looking at the activity that you want to get back to doing because pain isn't, it is essentially a warning system. You're never going to completely be without pain for your life. That's just not realistic.
Right.
But it's how, when you do get pain, what is it? How do you then manage that? And then how do you then decide I guess, what is that pain affecting or what is affecting causing the pain is a better way of saying that.
Right. So, what I'm hearing is it's a lot more contextual, right? Like a grandparent wanting to go for a walk with the grandkids, or athlete wanting to do certain exercises in the gym, and how do we make that happen given the pain that they have?
Correct. Yeah. Yeah. It's finding that kind of main goal that's not just about pain because pain is very, I can have someone who moves very well
Mm.
and there's still pain, or they have no pain, or they don't move at all, but they also have no pain, or they can have pain. So it's very, how they function can vary with the levels of pain, and is trying to slowly get them to understand that pain is normal in certain instances. Obviously, don't want it all the time, at least the chronic pain, but we
Mm.
can if we can at least get back to the activities we love to do, that is a big major factor. If you can do that with either no pain or very minimal pain, then that's amazing.
Right. So, what is the role of psychoeducation in, chiropractic setting, in clinical setting, when, you've talked about pain, pain is part of life. What kind of psychoeducation, or even if you can give couple tips, like what would you tell someone who's dealing with pain?
Yeah, it's tricky. It's it's to know that it is very normal. It is a normal part of being a human being, and that it is, like I said, a more of a warning system. So trying to make sure that it doesn't necessarily stop you from doing what you want to do.
To
Um,
adapt.
yeah, because there's different types of pain as well. Like there is good pain, I'll kind of call it, where you exercise and then you feel uncomfortable the next day. Usually it's soreness,
Yes.
discomfort is usually the words that are described to me. And that's good pain. That'll stick around for a little bit, maybe a day if you worked out really hard, usually a few hours, and then it's gone. It's more around that like sharp pain, stabbing pain. You feel worse the next day. That's when you want to make sure that you're just not your body just might not be ready for that movement or that activity at that point in time. So then we need to adapt and change it up a little bit.
Mm,
So a lot of the time it's around the wording, I guess I use and try to make sure that we have the goal in mind that people want to do,
mm,
and ideally try not to stop that activity fully, but just making sure we change a little bit about how they're doing it for a certain set period of time as they build up, whether it is tolerance, whether it's strength, whether it's mobility, to be able to get them to that point.
I like that tolerance and mobility. What is their goal, and how do we help them get to that goal? Uh, Sometimes, do you think people have to find a replacement activity? For example, they might be playing lacrosse or a basketball player or grandparent going for walks. Maybe they can't do that activity. Can there be replacement activity? Sometimes, is that something you would recommend or suggest?
Most of the time, yeah, it depends on the individual. Most people kind of, especially as they kind of have their activity that they really like to do. So, um, it's trying to figure out along with them essentially what other activities do they like to do. So usually an easy one is most of the time people, if they're doing any sort of running, is most what we're doing in a weight bearing position. If they can't do that per se, getting them to do an activity like swimming,
Mm,
where they're now not weight bearing, they're still doing the
enjoying.
like cardiovascular part that is very, very beneficial. And knowing that like, okay, you're still exercising. It might not be exactly what you want to do, but this is still going to maintain some level of activity, some level of fitness that is still beneficial for you overall, while the area of injury is recovering, to be able to get you back to doing the sports or activity that you really love to do.
Right. Okay. No, that makes sense. So can you give some strategies, Dr. Adam, in terms of what can people do at home, or how do they take care of, active lifestyle when they are dealing with pain or an injury? Like what are some of your tips, strategies, something at home folks can do to start taking things in their own hand, feeling a little empowered?
Lots of things. Usually, some of the main easy ones, obviously, is continue to move. So
Yeah.
movement is key to injury, is to healing injuries, to essentially getting back to that part. So in terms of, as we kind of just talked about before, in terms of what types of movement, it's usually movement that is pain free. So
Mm,
if you're doing something with your shoulder and it hurts going one direction, we'll move the shoulder another direction, and
right.
that's the one. So movement is very key. But honestly, a lot of times it comes down to uh, sleep. People usually take away sleep as one of the first things that they kind of cut out when life gets busy, and I get that because I've done that as well.
Yeah.
But if you're able to try to get relatively enough sleep, I guess, most days of the week, that is where you do rest and recover. A lot of things happen during that time frame. So whether it's just physically, but also mental as well. You're able to turn your brain off, recover well. So um, sleep is another big one.
Mm,
Eating healthy, whole foods, finding some very simple. There's lots of different recipes online. You can look up simple ingredients, meal prepping. Making sure you're intaking your food that is quite well. And um, another one that I've kind of sort of added in this year is either grounding, breath work, kind of meditation. I go outside and kind of lay in the grass for 30 minutes and just focus on breathing. I find that actually really settles down my nervous system.
mm,
Kind of gets me to refocus. The stress that I was feeling before really dissipates, and it did take some time. It's like anything, you got to practice it, but That's kind of a new one I've added this year myself that was recommended to me that I found has worked very well with stress management. If you're able to take 30 minutes is ideal because it does take some time. It almost takes me the first couple times, it took me almost 20 minutes to actually like finally relax well
Yeah.
enough where I was like,
Do
oh, okay, a
nothing.
change has been made. So yeah, so trying to do something like that. That's one that I've been recommending a lot more. Especially with nice weather, it's easy to go outside, just sit on the grass somewhere, and just focus on your breathing in and out. We kind of call it box breathing. You can do like
Yes.
4 seconds in, hold for 4 seconds, breathe out for 4 seconds, rest for 4 seconds. So I find that works quite a bit because you can relax that. If you get out of that kind of sympathetic, stressful state,
Hmm.
life kind of it looks a little different afterwards. That you kind of can refocus and get back to maybe a couple of tasks versus feeling so overwhelmed with multiple tasks.
No, that absolutely makes sense. We do box breathing a lot, like breathing, grounding in general. So when do you know that, a mental health counselor should refer the patient to a chiropractor, or what happens when you think, okay, this person needs more than just physical chiropractic care and they should be referred to a mental health counselor? Like, how do you figure that out, and how do you introduce that suggestion, right? Like, hey, see another practitioner.
Yeah, in my ideal world, it would be right away. But because I think if the earlier you can start affecting both structural, emotional, and mental,
Hmm.
the better you will be in the long run, and a lot you'll get better results.
Right.
However, that's not usually the case in the real world. So um, many a times, what I'm looking for is there already some things that they're bringing up in the first couple of visits around life, because I do ask some questions that are going on with their life, and just kind of seeing what they're willing to share, what they're not. Do I feel like there's something holding back? Um, and then for me to then be able to recommend that, I usually do it over a couple of visits in terms of just kind of getting them to trust me with information they're sharing with me.
Hmm.
Not necessarily recommending maybe something right away, or maybe just seeing have they done any counseling in the past, kind of letting it sit on that, and then usually at some point I'll give the recommendation of that I think that would be beneficial, and usually then go into a spiel of why that's beneficial. Is kind of touch on a bunch of things here of the mental, emotional, physical, and how they interrelate with each other, um, and how I've seen examples of that of patients with mine who have either plateaued or just things aren't the adjustments and the exercise and things aren't working as effectively as they typically should, and how we've seen some big changes when they finally then gone and seen counseling,
Right.
and got some of those things teased out. So
Right. Yeah.
um,
Like you said, it's all together, structural, physical, emotional. So, yeah. And that's why, like, I absolutely love when different practitioners work together. Right. So, no, everything you shared today is amazing. I do want to tap into your knowledge more in terms of pain, but let's leave that for another session. Any last words before we close our conversation today, Dr. Adam Will? How can people reach out to you? How do they book with you? I'm going to leave some information in the description below, but anything you want to add for the audience?
yeah, I mean, obviously, thank you for having me on, and always happy to share information. Yeah, I did just actually get my own website. So that is similar to my actual email address on here. It's docadamwill.ca. People can also reach out to me via email too if they have more questions as well. I'm always happy to chat. I can always do a discovery call and just to see if chiropractic is recommended for what they have going on, or if they just need some guidance, even just to kind of figure out what steps to take first. Because it doesn't always have to be with someone like me, but it can be very confusing as to who to see and when to see. So I'm always happy to kind of break that down and try to give some guidance on where to at least start. Because starting somewhere is best, whether it's with a chiropractor, whether it's with a counselor, just getting in somewhere and just starting that process. You'll always get benefits. And then it's just from there, it's figuring out what else will get kind of the whole full picture done.
Right. How long are your discovery calls, and are they free? Is there a cost to them?
They're free. I book them in for about 10 minutes, but it kind of depends. I'll sometimes go longer depending on if there's more in depth that needs to go on. So
Yeah.
um, Yeah.
And they can email you. We have this email here, docadamville@gmail, and then this is your number. They can text you 778-325-4439.
Yep. Yeah. If they have any questions, and then if they did actually want to book anything, yeah, it's through my website. There's the booking. Super simple. Most clinics use Jane's, so it's keeps it
Perfect.
nice and easy.
Awesome. No, that sounds wonderful. Thank you so much for your precious time today, Dr. Adam. We'll close the conversation here and let's connect again another time.
Absolutely. No, thank you so much.